It's my pleasure to be here to talk about something that to a lot has been very controversial. And when I first heard and experienced the aspects of low-level therapy, low-level energy therapy, period, I was skeptical. And I'm a born skeptic. So what I'm going to bring you through is some of the history and then some of my own work that really tended for me to get rid of all of that skepticism. Okay, good. For disclosure for this, I have gotten research grants from Marconia, which funded studies that we performed. So the application of energy, low levels of energy, whether it's electrical field, ultrasound, or light for the treatment of disease or especially for aesthetic improvement has met with a lot of skepticism. We're trained to believe as clinicians, especially surgeons, that more and stronger is better, that no pain, no gain, and that low energy treatment represents either a placebo effect or a voodoo effect or faith healing. And I think what I started learning across time is that there is significant scientific evidence that really supports not only the notion that low level of energy treatments, whether it be low level laser therapy or other energies, have effect, but indeed there are some very, very specific molecular bases of these effects. So really, we're getting away from the aspect of the hands-on faith healing, and now what we're going to do is move into the realm of science. So the external application of low-level light, such as laser light at specific wavelengths, can permeate into deeper tissue. Low-level laser therapy also can be called photomodulation because what's happening is we're not heating the tissue, we're triggering certain biochemical effects. And these effects can affect cellular processes, modify cellular activity, especially when it comes to cellular energy. And there have been many wavelengths that have been studied. One of the big concerns and one of the big confusions is the difference between looking at low-level laser energy and LEDs. LEDs are a recent development, and while some LEDs are very effective because of the way they're made, many are inexpensive, widely used, and really aren't worth the silicon that they're printed on. The wavelength's not coherent, the energies aren't consistent, and therefore, especially when you see devices for hair growth and other things that really don't work very well, it's this aspect of these LEDs. And the low-level laser device that I'll speak of, 635 nanometer, 17.5 milliwatt, has been very, very widely studied, and there's a great deal of data on this device. So let's talk a little bit about science. Well, how in the world would this work? Well, it's not heating tissue, it's not ablating, it's not subablating, it's triggering. And one of the biggest targets is cytochrome C oxidase. Cytochrome C oxidase is a multistructural protein. It's got a binuclear copper center and a heme center. And this is very akin to chlorophyll in plants. And you can trigger this, and the triggering facilitates transfer of electrons from water-soluble cytochrome C to oxygen and facilitates energy changes and movement. And it's through this effect on cytochrome C oxidase that you can stimulate mitochondria, increasing ATP production by upregulating cyclic AMP. There's another cascade that works that's very well known called the nitric oxide. And nitric oxide enzymes have many cellular effects. This whole cascade can be thought of as the body's primary non- or anti-inflammatory cascade. It's very, very important because this together, what we see is we see increasing energy in the cell, certain specific effects, as well as an anti-inflammatory effect. The other thing that we're going to talk about very clearly is that the cyclic AMP also stimulates cytoplasmic lipase, converting triglycerides into fatty acids, and this is part of the aspect of how it affects fat and remodeling. It's been widely studied, this wavelength, in many areas other than body contouring, from wound healing to heart disease, and this is just a little bit of a pictorial where you're looking at aspects such as improving heart disease, talking especially about joints, arthritis, pain, tinnitus, many, many areas, especially wound healing, from this aspect of low-level light in this wavelength. Now, the fat cell is really what we're going to be talking about primarily, and low-level light, as I said, stimulates mitochondria, increasing cyclic AMP. It stimulates cytoplasmic lipase, converting triglycerides to fatty acid, and it also causes a transient pore in the adipose cell, allowing for movement of the glycerol, triglycerides into the extracellular space. And this, it also improves the oxidation of the fatty acids, which occurs inside the extracellular space. And this pore formation here is well documented, and it's a secondary reaction in the cell. And what you see actually very, very nicely microscopically is the shrinkage of these fat cells, both in vitro and then a correlation, as we'll talk about, in vivo. This is this low-level device called the Zerona, and it's got 5 independent laser diodes, 635. The normal treatment regimen for this is 3 times a week for 2 weeks, 6 sessions, but there are many variants of this, and some of what I've learned about actually in this last weekend has been very, very amazing from people in clinics doing multiple treatments and having really astounding results on many aspects. And I'll talk about this because in using triggers to the body, not only are we affecting the cells which the light can reach, but we're affecting systemic changes. And those systemic changes I'll talk about in a minute. What's interesting is that you get very quick changes where you wouldn't think you're going to get penetration because of the interaction and communication between cells. So what you see here on top is the fat, and it appears bright here. What you see here is a partial coalescence 4 minutes later, and 6 minutes later here what you're seeing is the homogeneity of the fat. So it occurs very, very quickly. Now, the pivotal study was the 67-patient multi-site study. No diet changes, no supplements. This has really not been properly discussed when others are talking about this study, but indeed, this has nothing to do with diet and supplements. 6 treatments, painless, no downtime, no AEs. Overall, this was a sham-controlled study. It was blinded, and for the sham treatment, we got about a -168 centimeter reduction versus a 9.1 of the treated using the light. And this is a combination of the waist, hip, thighs area. And this was highly statistically significant, and indeed, the success criteria was a 3-inch reduction in the combined circumference. And what we see here is about 62% met the success criteria in the test group, and only 6.25 in the placebo group. And again, this was highly statistically significant. What's also interesting, again, patients got sham treatment. They didn't know, and it's a painless treatment. They didn't know whether they got the real treatment, but the satisfaction rates were very high in the test group versus the placebo group, and the dissatisfaction rates were very high in the placebo group. And this was also very highly statistically significant. What's very interesting is that there were systemic effects, very positively, of this treatment. In addition, the overall cholesterol decreased statistically significantly, about 12 points. And the leptin is one of those serum proteins that has to do with inflammation and fat, and the leptin levels went down very significantly too. So there are very positive effects, and in fact, some work is being done right now to look at the aspects of metabolic syndrome, of obesity, in terms